I would want to ask you first of all, what is uterine artery embolization and when is it needed?
The uterine artery embolization means like we are blocking the uterine arteries. So this procedure is an endovascular procedure, doesn't need any scars. It is a simple pinpoint punctures, can be done with a radial on a daycare basis. And this procedure is usually indicated in the patients where there is a lot of bleeding per vagina, or there are uterine fibroids which are causing menometrorrhagia, that is bleeding multiple times in a month, or excessive bleeding. And if the patient has pressure symptoms, many other cases with uterine bleeds or AVM, that is vascular malformations in the uterus, which can lead to bleeding and can be catastrophic and deadly. So in this procedure, what we do is a simple thing, like we take a puncture from a radial artery that is in the hand or from a femoral artery. We enter the uterine arteries through our catheters, specialized catheters, and we embolize it with different particles. Permanently block those uterine arteries, knock them off, and the patient symptoms are quite relieved post that. And this is like if we do it from the radial artery, it is like a daycare procedure. We can send the patient on the same day or next day, depending on the conditions. With the femoral artery also, the scar is not there, no scarless surgery, painless surgery, and patient is always in conscious level. So patient doesn't need to be sedated, or we don't need to give her any general anesthesia. Or
how is it better from a conventional modality of management, maybe a myomectomy? How is UA better than that?
See, uterine artery embolization, now the era is all shifting towards the endovascular techniques, the minimally invasive techniques, where like without any puncture, scarless techniques, you can go ahead and get the same results as we are getting in a traditional conventional surgical treatment. But majority of the other fibroids, this technique of uterine artery embolization holds great. And with the single punctures and embolization, we can treat as many as fibroids are present in the uterus. Secondly, patient doesn't have to undergo any anesthesia risk. Patient doesn't have to undergo any hysterectomy risk. Patient doesn't have to undergo any morbid procedural risk.
If I could ask about your clinical experience on the results on your patients, and what is the present literature evidence against this procedure?
See, the present literature evidence shows very significant reduction in size and relief in the symptoms. Almost 85% cure rate in majority of the studies. And usually what happens is the myoma size, it takes time to get reduced. It takes around 3 months to start reducing the size, but within a year or so, there is a significant reduction in the size of the myomas or fibroids. Secondly, the pressure symptoms, or say the uterine bleeds, the menometrorrhagia or metrorrhagia, where excessive bleed is there, it gets relieved very early. With the embolization, we get relief of the bleeding symptoms. Heavy bleed cause anemia. So with the embolization, where we don't need to give any GA, we can do it in an immediate way. We don't need to prepare much. Patient is relieved from the bleeding and patient gets better. Uterine artery embolization is really a boon in the endovascular management of many patients, not just the fibroid, but any bleeding per vagina.